Welcome to this explainer. Today, we're diving into a really startling public health shift, one that literally shatters almost everything society assumes about aging, intimacy, and health. We are looking at a hidden epidemic, one that's been quietly building over the last decade. And it actually involves a demographic you probably wouldn't expect.
So, let's start with a bit of a provocative question just to test your assumptions. When you think about the fastest growing demographic for sexually transmitted infections, or STIs, who comes to mind? Is it teenagers? Maybe college students in their early 20s? Well, prepare to have your expectations flipped completely upside down.
We are looking at a dramatic, nearly 24% spike in STI diagnoses among seniors. That's folks aged 65 and older just between 2020 and 2023. And this isn't a small sample size. According to a massive analysis of 47 billion, yes, billion with a B, commercial health insurance claims by Fair Health, this demographic is outpacing almost every other age group when it comes to the growth rate of new infections. Moving into Section 1, Myths about Aging and Sex. We see this all the time in the media, or even just in the way healthcare providers interact with older patients. Society tends to treat seniors as, frankly, completely sexless, but the data tells a totally different story. An AARP-sponsored poll actually confirmed that 40% of adults aged 65 to 80 are sexually active. Nearly two-thirds say they're still interested in sex, and a really significant portion are having it on a weekly basis. So older adults are absolutely living vibrant, sexually active lives. And then, well, there's the fear factor, right? The whole myth that exertion during sex is a massive heart attack risk for older adults. But medical experts at Johns Hopkins have actually calculated this. The absolute risk of a heart attack during sexual activity is exceedingly low. We're talking about 3 chances in 1 million per hour. To put that into perspective, statistically speaking, you're at a much higher risk of a cardiac event out shoveling snow than you ever are in the bedroom. So the absolutely crucial point here is that crossing a certain age threshold doesn't just magically grant you immunity from sexually transmitted diseases. Age doesn't protect you, but because of all these pervasive myths, people just aren't talking about it. And that silence is directly leading us into our main public health challenge. Which brings us to Section 2, the senior STI surge. Over just a short 5-year period, from 2018 to 2022, infections among adults over 55 completely skyrocketed. Get this, we're talking about a 55% increase in syphilis rates. Chlamydia is up 32%. Syphilis, in particular, is hitting historic levels nationwide. Literally, rates we haven't seen since the 1950s. And if we expand our view back to 2010, looking at the long-term trend, the American Medical Association reports numbers that are, well, they're truly staggering for folks 65 and older. Syphilis cases have grown an astonishing 10-fold. Gonorrhea is up 6-fold, and chlamydia cases have more than tripled. So this isn't just a blip on the radar, it's a sustained, decade-long explosion in transmission. But what's truly fascinating here is the generational contrast. Diagnosis for young adults, those aged 19 to 24, actually dropped by 6.6% between 2020 and 2023. But meanwhile, the rates for the 65-plus demographic shot up by nearly 24%. We're seeing this complete generational inversion of where the highest growth in sexual health risk is actually occurring. All right, Section 3, what is driving the trend? We are essentially looking at a perfect storm. First up, medical advances. Since Viagra hit the market back in 1998, followed closely by various hormone replacement therapies, seniors are able to stay sexually active far, far longer than previous generations. Second, there's absolutely zero risk of pregnancy, which historically was kind of the primary motivator for condom use. Add to that the fact that people are just living longer, but differing life expectancies create these partner gaps. And finally, you have the widespread adoption of modern dating apps. And then there's the behavioral piece, and it can be summed up by one shockingly tiny number: 3%. According to the AMA, that is the percentage of sexually active people aged 60 or older who reported using a condom in the past year. Just 3%. Because pregnancy isn't a concern anymore, protective measures are almost entirely bypassed, and this creates a massive vulnerability to bacterial and viral infections. But wait, technology is accelerating this risk even more. Researchers from the Chicago schools studied this fascinating phenomenon called sexual discounting. Basically, it's a behavioral psychology term for when someone devalues protected sex in favor of immediate, unprotected sex. The research found a really strong correlation between people who use dating apps and highly impulsive sexual discounting.
Zooming out to look at the broader epidemic, which totals tens of millions of infections nationwide, the role of technology becomes incredibly clear. In early 2022, 39% of all single, divorced, or widowed consumers reported using an online dating site in the just previous month. Dating apps significantly increase the number of casual partners and unprotected encounters. And yes, seniors are actively participating in this whole digital dating ecosystem. Okay, on to Section 4, geography and social factors. Geography absolutely matters here. For instance, among adults 55 and older, Washington, D.C., Nevada, and South Dakota actually have the highest rates of syphilis. Why is that? Well, local officials point to heavy impacts from pandemic-era healthcare interruptions, localized budget cuts to STI prevention programs, and just a general lack of targeted sexual education for older demographics. Furthermore, a recent Yale sociological study adds incredible depth to this whole picture. Because women naturally outlive men, it creates a demographic partner gap in later life. And this imbalance, it sometimes leads to the sharing of partners or individuals having multiple partners. The study also highlighted some stark racial disparities, noting that minority women, particularly Black women, spend significantly more of their later years living alone or divorced. And as seniors move into community living, like nursing homes, they're entering tight-knit environments that foster brand new, and sometimes overlapping, casual sexual networks. Finally, Section 5, navigating health and safety. So first off, the medical field has some amazing tools to help. The National Institute on Aging reminds us there are excellent treatments out there, everything from over-the-counter moisturizers to prescription estrogen, just to keep sex enjoyable as our bodies change. But safety is absolutely paramount. We have vaccines for hepatitis B, Mpox, and really importantly, HPV. HPV alone causes 44,000 cancers annually in the US, so catching up on these vaccines is incredibly crucial for older adults who are entering new relationships. And science is adapting to these behavioral realities too. Dr. Sandra Adamson-Freihofer from the AMA recently described a new treatment called Doxy-PEP as a sort of morning-after pill for STIs. Basically, it's a dose of doxycycline taken within 72 hours after unprotected sex, and it can significantly help prevent the onset of gonorrhea, syphilis, and chlamydia. Ultimately, navigating this safely comes down to just a few simple, actionable steps. First, you really have to talk openly with your doctor. Studies show that only 17% of sexually active seniors have actually discussed sexual health with their provider recently. Second, get tested. Medicare actually covers STI screenings, so use them. And third, use barrier protection. Condoms and dental dams are still the most effective way to stop the transmission of these infections. Looking at all this data, the ultimate takeaway is crystal clear. We have got to replace societal stigma with open, informed conversations. Doctors need to be asking the right questions, and patients shouldn't feel embarrassed at all to bring it up. Normalizing sexual health at any age is literally the only way to protect this thriving, active demographic. So I'll leave you with this final thought to ponder. As medical science allows us to live longer, fuller, and healthier lives, isn't it time we finally normalize sexual health checkups for our parents and grandparents with the exact same urgency we do for younger generations? Honestly, breaking this taboo might just be the single most important public health step we can take for the people we love. Thank you so much for joining me on this explainer today. Keep asking questions and keep learning.